start?
1st of April 2014, Dachshund, male, 8 years old.
Wait, what happened? He sneezed blood
Yeah.
yesterday night.
Yeah.
Is it the first time?
Yes.
Previously he didn't sneeze blood.
No.
And which nose? There are two nostrils here. Which do you sneeze from?
I think both.
Both,
Charcoal.
How about today?
Never.
Oh, he doesn't like it. Huh?
Yeah, charcoal.
Was there an accident or something? Did he bang his nose?
No.
How do you know? How do you know whether he banged his nose or not?
Because like when he went out, he was okay. But he didn't like bump into anything.
He went out for exercise.
Like on his nightly walk. But
After the walk, is it? He sneezed blood?
Yeah.
After walk?
Like when we came home, at home like, then after that at night about like.
Later in the night, huh?
Yeah, like 11 plus.
11 p.m. Okay. Does he like to dig onto the soil, dig his nose onto the grass? And
He just sniff around, but he doesn't like stuff his nose into the dirt or anything.
Does he bite people?
Yeah.
Normally there's some pain in the nose there. No. Can you open his mouth? He bites you or not?
Sometimes.
Just show the video there. Just open the up to see any bleeding or not. Huh? Now the teeth is really bad. Huh? The teeth is really bad. So that sometimes the cause is due to the infection of the teeth of the roots going into the nasal sinus. So that is one reason. The other reason is injury and traumatic injury. He banged his nose, but there's no more bleeding, right? No more sneezing blood, right? How's appetite?
Okay. Same.
The urine, the drinking, and the stools are normal.
Yeah.
Okay, there's no fever, so let me check his lung. He always bites fever.
Sometimes when
Once
he's
in a
not
while.
comfortable.
There seems to be some swelling on the left side. Is it a normal? Do you see the swelling? Come from the side. Do you see? There's a bit of swelling on this side. There's a bit of swelling here. On this part. We do by palpation and see whether it's painful or not. Lucky he's quite patient with me, if not. I check the premolar. The premolar 4
Charcoal.
is painful. The premolar 4.
Charcoal.
So
No boy.
it could be due to the abscess on the premolar 4.
Charcoal.
No boy.
Okay, so then the other side I check the heart and lungs. Look in front. Okay, I know he doesn't like it. You ever bitten bats before?
Sometimes he's muzzled.
Yeah, you have to muzzle him. Any coughing?
He sneezes a lot, but
No
he
coughing.
doesn't really cough.
Okay, let me have that here.
Charcoal.
He's a dangerous patient.
No. No.
Just talk to him. Come this side.
Quiet.
So there no more bleeding from the nostril now today?
Yeah, today never.
No more, right?
No.
Any more sneezing today?
Today not yet. Usually when he's cold, he sneezes more.
Cold.
Yeah.
Aircon.
Like rainy season or anything.
So this is not the first time that he's sneezing.
No, it's been for quite a while already.
This year.
Last year also have. Last time we came also, we did X-ray also.
Last time he's got pneumonia,
Yeah, something.
according to the case sheet. And did they advise you on the dental or not? The teeth are all rotten, periodontal disease.
He doesn't like it when people brushes his teeth.
No, under anesthetic we do the dental scaling and clear the teeth. Because one of the reasons is the infection from the premolar 4, the back one. And the root is infected, so it goes through the sinus, the nose, then it sneezes up. What color is the blood? Is it blackish? No.
No, reddish.
Red blood, huh?
Yeah.
Now, in November 2013, which is only a few months ago, 6 months or 5 months ago, he does have pneumonia. So there was an X-ray done, right?
Yeah.
So what did the vet say on the X-ray? Anything?
I think it wasn't very clear or something. Then said that the heart was a bit swollen, something like that.
He said it could be possibly a lung tumors, you know.
Yeah.
But is there any breathing problem? Difficulty in breathing?
Besides sneezing, he like he wheezes a bit. Then the vet says like reverse sneezing or something like that. Yeah.
So so after that, after November 13th, after the treatment, what happened? Is he okay already?
About the same. He still sneezes from time to time.
Even since November?
Yeah.
So the best is to do the simple things, do the teeth first, because if they are rotten teeth, at least we extract it off and clean up the teeth. At least there's the simple things. The other thing, of course, is the lungs, either tumors or infection. But that one is more detailed examination needed. So that is my advice. Did the vet didn't advise on the teeth?
No.
Because many old dogs they don't do the dental checkup. This dog has no dental checkup before.
No.
No. So what do you think? If you want, then we will do the teeth, and then at least
Carry out one possible cause.
possible cause the bacteria going through the sinus and the nose, and also it goes to the lungs. Are you sure the dog doesn't cough? You hold the mouth, hold the muzzle, and then you check the throat. Ready? No, just grip the muzzle. Just talk to him. Let me check the throat. You look in front. Just talk to him.
Good boy. No, it's okay.
Okay, then cough.
Okay, but
Then cough. See, he's got sore throat, so there's some infection also of his throat. Also the cough. So you leave the dog here, and then we give him antibiotic first. Then tomorrow then we do, because now he's probably not well. He's eating, but he's eating normally, right?
Yeah.
Are you sure you never hear him coughing? Because he seems to have a sore throat now.
He very rarely coughs, right?
yeah, very.
Very cough, but sneeze a lot.
Yeah, he sneezes more than he coughs.
Sneezing.
Sneezing every day sure have one.
It could be environmental, like you say. Environmental
See?
rhinitis, we call it, where is it very dusty like your face?
Not really,
Not really dusty.
yeah.
Only this year, right? Last year it's okay, right?
Last year also he's been sneezing a little bit,
Okay. So of course one of the possibilities is allergies from the air surrounding it's one possibility. But so we do one step at a time. I'll give him antibiotics. So just talk to him. Talk to him. Okay, boy. Just talk. Don't talk.
Now,
No,
boy.
you don't talk to him. You just
Okay, it's
talk to him.
okay.
You talk to him.
Okay, boy.
It's okay, Chaco.
You talk to him.
It's
You don't know.
okay.
You finish already. You talk to him. You finish already.
Okay.
Very brave, huh?
Good boy.
Then, so we'll put it in for dental first.